My name is Ricky Wood. My patient is a 48-year-old left-handed male who reports onset of left shoulder pain after painting his house 2 weeks ago. My patient works as an electrician and enjoys playing tennis and reading on his tablet and lives alone. He states that he is unable to play tennis and would like to be able to return to playing tennis without shoulder pain. He experiences pain at a 2 out of 10 at rest, at a 6 out of 10 when performing overhead activities, and a 4 out of 10 when reaching overhead during his job. Inspection of his shoulder was unremarkable. His standing alignment revealed a mild thoracic kyphosis and forward head, and protracted scapulae on both right and left sides. The physical exam of this patient's shoulder revealed pain at end range with active elevation, and he was positive for the painful arc sign during active abduction. He experienced pain at end range with passive shoulder abduction. Resisted testing was strong and painful for abduction. The patient was positive for the special tests of empty can, Neer, and Hawkins-Kennedy. Joint mobility assessment indicated a restriction with the posterior glide with the shoulder flexed to 90 degrees. MMT revealed weak middle and inferior trap at a 3 out of 5 on the left and a 4 out of 5 on the right. MMT of the infraspinatus and teres minor was also at a 3 plus out of 5 on the left, and MMT of the subscapularis was a 3 plus out of 5 on the left. My differential diagnosis includes the PT diagnosis of shoulder pain and muscle power deficits, specifically rotator cuff syndrome. I came to this conclusion by ruling in contractile tissue with pain during resisted tests. I also went away from non-contractile tissue because passive tests were negative. Pain with resisted shoulder abduction and positive empty can suggests supraspinatus tendinopathy. Another indication that led me to supraspinatus tendinopathy was a positive painful arc sign during active shoulder abduction. Contributing factors for this patient include poor posture, weak postural muscles, and capsule restrictions. This patient seems to be in the moderate tissue irritability due to the worst pain being 6 out of 10 in the past week, and 2 out of 10 at rest. I believe this patient is a good candidate for physical therapy, and the treatment plan would include exercises to decrease pain, improve function, and trying to get him to return to full participation and work. My treatment plan for this patient would first start with working on postural muscles and postural stability. Some of the exercises that I would include would be open books, scapular pinches, and shoulder shrugs, just to make sure that this patient is getting proper postural movement. And I would also indicate that to the patient that he should make sure to avoid any aggravating activities such as anything overhead, just to make sure that we keep that pain down. The next portion of my treatment plan would include alternating isometrics, open chain progressing to closed chain. I want to make sure that this patient is activating the rotator cuff so we can decrease the pain and make sure that all the rotator cuff muscles are firing appropriately. Also in my treatment plan would include the posterior glide mobilization with the shoulder flexed to 90 degrees, 3 sets of 60 seconds to make sure that we are decreasing pain and also increasing the mobility at the glenohumeral joint. Finally, I would like to work on neuromuscular re-education, focusing on the scapulohumeral rhythm and making sure that this patient has proper scapulohumeral rhythm when going into shoulder elevation. I would also indicate to this patient that he should have a home exercise program so he can work on those muscles and those pain decreasing exercises while he is away from physical therapy so he can make proper gains. Some of the components in the home exercise program would include pain-free isometric exercises for the rotator cuff, specifically pushing into the wall. I would indicate that this patient should hold the isometric contraction for 10 seconds and then do it for 5 reps with each motion, external and internal rotation, as well as shoulder flexion and abduction. The purpose for this is to increase muscular strength without increasing pain. I would also instruct this patient that he should try and be cognizant of his posture at all times and work on using a mirror or a wall at home and making sure he's standing up tall and pinching his shoulder blades back so we can work on those postural muscles at home. Also at home, I would like the patient to be doing some trap exercises to work on that weakness in the middle and lower traps. So I would like him to do open books and scat pinches for 3 sets of 10 reps at home. And also I would like him to do some isotonic exercises for internal and external rotation to treat the strength deficit in both the internal and external rotators. So preferably I would give him a light colored TheraBand and have him shut it in the door and do internal and external rotation resisted for 3 sets of 10 reps. That would be my treatment plan for this patient.